Hi guys, welcome to another episode on health and wellness for all. Today let's talk about inflammation and what is an anti-inflammatory diet. So stay tuned to hear more. Hi guys. So we keep hearing, especially over the past few months we've been listening to a lot about anti-inflammatory diet. So, what exactly is inflammation and what is this anti inflammatory diet? So, to understand that, what is inflammation? So, our body is got immunity, there is an immune system, and this immune system gets activated whenever there is a threat. It could be in the form of some infection, it could be a microbe, it could be a plant pollen which is causing an allergy, or any chemical, anything, even cancer. So our body has these set of inflammatory mediators which will fight against this infection or cancer or this foreign body to protect us. Now what happens is that sometimes this process of inflammation, if it is intermittent, if it comes and goes whenever there is a threat, then that is useful for our body. But in certain conditions, what is happening is that this inflammation is persistent for a long time. For example, the reasons are the chronic stress that we are facing nowadays, the kind of food that we are eating, the processed refined food, extra sugar and salt, and lack of sleep. All of this is producing an environment of chronic stress and inflammation in our body. And this chronic inflammation, what happens is that those protective methods like the cytokines or those protective mechanisms which help our body then go against us, and this chronic inflammation becomes our enemy. So there are mediators which are called cytokines. These are chemicals, leptins. All of these produce inflammation and they start attacking our body in the form of various diseases. So if you have heard of heart disease, diabetes, cancer, Alzheimer's disease, in gynecology, chronic pelvic pain, endometriosis, all of these are part of an inflammatory process. Now, doctors have also understood that the treatment for many of these diseases is not just medication but also a change in the diet, and by following an anti-inflammatory diet we can have a solution which is long lasting. Now if I am talking to you about diet, that doesn't mean that you stop eating this, stop eating that, and totally change everything that you eat, because it has to be a pattern of eating which is sustainable over the long period of time. Going into fad diets, paleo diet, vegan diet, going into total extremes of diet also is not very healthy. So what can we do about it? We have to avoid certain stuff and we have to add certain stuff, and we have to do it one step at a time. Have to take time because our body has got used to certain kind of foods, so you have to wean off certain foods and you have to add certain foods. Think of yourself as a baby when you do that, because suddenly when you change you will not be able to sustain that kind of a diet. You will go into binge eating then. So what we need to do is that you are going to add the healthy habits into your system, which could be adding fruits, vegetables, and you have to avoid certain food stuff. So what you can avoid first is try to avoid some white, like white sugar, white flour, and if not totally reduce it, you can minimize the intake. Similarly, instead of white sugar, you can add jaggery, you can add supplements which are healthy. So don't go for artificial sweeteners. So reduce the intake of sugar. If you're not able to totally cut down your sugar, at least reduce the intake of whatever sugar you're taking, white sugar, brown sugar, and try to slowly replace it with sweet like good quality honey or jaggery. Another thing is you can avoid soda, or again start reducing the quantity. If you can avoid, that's the best. And what do you replace it with? You replace it with coconut water, replace it with water, with fresh homemade juices probably. So soda again probably. So if you're in the habit of taking a soda every day, probably you cut it down, keep it only on the weekends, and when you feel like having, first drink water, coconut water, and probably write it down somewhere so that you remember what to do. Another important thing is that when we talk about different type of diets like a vegetarian diet or meat-based diet, so avoid the processed food. Processed food is something that you are not cooking from the beginning. So when you are going to the supermarket, make a list. Don't go when you're hungry, that's important. Read the labels, that is important. Make a list and go, because if you go when you're very hungry, you will tend to buy stuff which is more packet stuff. So read the labels. It is very important to see the sugar content in the whatever you're purchasing, and see that the food is original as it is. So it could be fish, but if it is like a finger fish or a fish fry or something which has been processed and cut and frozen, so try to avoid the frozen stuff, the canned food, stuff to which preservative has been added, and try to get the food in more natural form. For example, even if you're going to take any chicken or meat also, taking it in a more natural form is a better idea. Trying to identify the source of the animal based food that you are taking. If it is milk, for example, there's a lot of controversy about milk. So I would not say milk is good or bad, because it all depends. One glove doesn't fit all, one size doesn't fit all. You have to see which kind of milk is good for you. So if you like dairy regular milk, fatty milk or low fat milk or skimmed milk, try to get the less processed one. Try to see the source of the milk. So the if it's a cow's milk, then what are those cows fed on? Is it organic milk? What kind of, is it grass fed, and what about the hormones which are added? So make sure that you identify the source of the milk also that you're taking and consuming. Again, fats. If you talk about fat, try to avoid trans fat, which comes in the form of the snacks which come in packets, hydrogenated fat. So look at the amount of trans fat and hydrogenated fat in the labels of what you're eating, in the fast food or the junk food that you're eating. That is definitely going to have high levels of trans fat, which is not good, because that increases the bad cholesterol, the LDL. Try to look for good sources of fat, which could be so try to use more olive oil, canola oil, wood pressed coconut oil. All these oils are groundnut oil, sesame oil. So again, try to identify the source of the oil that you are using for cooking, because not all fats are bad, and we need some amount of good fatty acids also in our diet. So don't eliminate fat totally from your diet. Also look for sources of omega-3 fatty acids and include them in your diet. We will have a separate video on omega-3 fatty acids. Again, for those of you who are meat lovers, I wouldn't say avoid red meat totally. Probably you can reduce the intake of the red meat, and again look for the source, because if you cut down on all animal products, then you can go in for a vitamin B12 and a vitamin D deficiency. So balance is what is important. So try to include more whole grains. You could take wheat, quinoa, millets, ragi. There are so many type of grains which are available. Try to include more legumes into your diet in the form of pulses. You have different kinds of chickpeas, the black one, the red one, the white one, and these will have really good sources of protein. So try to include that, because it increases your fiber content also. Again, fresh fruits, vegetables are much preferable to animal food. So try to include, say, even if you're having something non-vegetarian, include a nice bowl of salad to it. You can have lettuce, carrots, cucumber, fruits like apple, banana, papaya, watermelon. All the different colors are available. So adding fruits and vegetables is important. Adding salads, especially raw salads, is important. Trying to cutting down on the processed food, trans fat, hydrogenated fat is also needed. Again, try to limit your alcohol, because if not reducing it absolute to zero, if you limit the intake of alcohol, inflammation does come down. Caffeine, again, limit the caffeine intake if you're not able to reduce it totally, because caffeine, again, don't take it the first thing in the morning. Try to take it after your breakfast or in the mid-morning. Try to reduce the quantities. Try to reduce the sugar, because the coffee or the caffeine that you're taking in huge amounts, and if you're adding a lot of sugar, a lot of cream, a lot of milk to it, then that is going to increase the unhealthy fat into it. So make sure that you are being very mindful into what goes in your plate and what you put inside your body 3 times a day. So lastly, you could probably even replace your caffeine with green tea maybe once a day. You have to see what suits you best. When you come back from work, try to avoid the snacking immediately. So you can have a plan, write down meal plans, or all around your house you can keep these nuts, almonds, walnuts, cashew nuts, raisins in different boxes, so that when you come back from work and you're tired, you try to snack on these. Of course, use the unsalted variety. Maybe you can cut a fruit salad or a bowl of veggies, so that when you come back, then you can eat that rather than taking some unhealthy snacks. So don't store a lot of unhealthy snacks also at home, because if it is there, you will be tempted to eat that. So just remember that being mindful, make a plan, make a list of what you want to purchase, what you want to buy, get the smaller quantity so that you are not tempted to eat more. Include more fruits and vegetables, dry fruits, get good healthy source of fat, cut down on soda, on caffeine, on alcohol, and that's the way to start the process of an anti-inflammatory diet. And if you follow it for even 2 to 3 weeks, you will find a difference in the texture of your skin, your hair, and your well-being. So looking forward to interacting with you. More videos coming soon. Take care.